Well, Terry, I think I have a pretty good idea of what's going on with you. You got some anxiety that's related to not having enough work to do and the economic stress that's causing for you. Let me ask you about something else. Sometimes use of alcohol or drugs can contribute to anxiety. I noticed that you filled out one of our drug questionnaires. Could I take a look at that and maybe give you a little feedback?
Yeah. This one? That's right?
Yeah, that's it. Okay, and let me just clarify how much alcohol or drugs you might be using on average. How many days a week or month would you have a drink that contains alcohol?
Oh, no alcohol use at all. I don't drink at all. Alcoholism runs in my family, so it's just something I choose to stay away from.
Okay, so zero alcohol.
Yeah, no alcohol.
Very good. No risk related to that. I noticed you did fill out our drug questionnaire, though. Could you tell me in the past 3 months what drugs you've used, any street drugs or any prescription medications in a way that was not prescribed?
Yeah, well, I'll go on and tell you I use marijuana pretty much every day. You know, yeah. So
on a typical day, how many joints or blunts would you smoke?
I'll smoke on a typical day really at least 1 or 2 joints a day.
Yeah. Okay. Yeah. What are some of the good things about smoking marijuana for you? Most people who smoke do it because it does something good for them.
Well, for me, it's been you know, with the stress of everything that's going on, it's just that me time that I get to just sort of relax for me. So
a little getaway.
Yeah, exactly, exactly. So that's.
What other good things about smoking marijuana for you?
Well, you know, in college I've got a back injury from football, and I will say that when I use the marijuana, it does help relieve the pain.
Okay, so you get some pain relief from it as well.
Yeah.
What are some of the not so good things for you about smoking marijuana?
Well, it's funny you asked that. I know that a few years ago it affected my license for trucking. They did drug testing, and of course I never used while I was driving, but it was in my system, so I lost my license.
Oh wow! So that was big.
Real big financially. It's put a hit on everything. So yeah.
Yeah. What are the not so good things, if any, about smoking marijuana?
Well, my wife, she tends to bring it up that it's a bad influence for the kids. You know, we did use together when the kids came along. She stopped, but I continue to use. But I guess if we got to use another issue that comes up, it is between me and the wife that using it has not been a good example for the kids.
Got some stress or conflict there because of it.
Definitely that. Definitely that.
So on the one hand, it does give you some me time and an ability to kind of get away and relax and maybe manage your back pain a little bit better.
Right.
On the other hand, it's had some big job consequences, and in addition to that, now some friction in your relationship with your wife. And as your physician, I can tell you one of the medical consequences of smoking marijuana is that sometimes it actually increases anxiety. Sometimes just from the drug itself, or sometimes as it's going out of your system, you get a little withdrawal symptoms related to the anxiety. So you got some good things, some not so good things. Where does that leave you in terms of continuing to smoke the same amount, or maybe cutting back or quitting?
I mean, well, today you're giving me a lot to think about. I mean, you know, first the job, and then of course my wife, and then now I'm hearing it from you. So it got me thinking. I will say that.
Information's kind of mounting for you.
Yeah, it is. It is.
Well, let me ask you, on a scale of 0 to 10, if 0 would be not ready to make any change, or 10 would be I'm really ready to make a significant change today, where would you put yourself in terms of being ready to cut back or quit your marijuana use?
That's a good, on a scale of 0 to 10, maybe, I'm going to say 5.
Right in the middle.
Yeah, just because of, yeah.
Why 5 and not a 3 or a 2?
Well, I wouldn't put it as low as 3 or 2 because just like I shared with you, just with my job and that I lost lost my license, and with it being an issue that comes up between me and my wife, and then now today, so I would say that's probably the reason why I got it at a 5. Just, I don't know.
Yeah, so you got some things that are really making you think about it.
Yeah.
Well, let me tell you what I thought we might do with your anxiety today. I thought we might start you on a medication that's very safe, non-addicting. I'd try probably some sertraline medicine that you'd take every day, and slowly, it's not going to take away your anxiety immediately, but will slowly bring down the anxiety level in your life. And then we also could engage in some counseling if you're interested. Somebody who could help you learn to deal with stress. Think through the issue of what to do about your marijuana use, and also do some marital counseling with you and your wife if you like. What are your thoughts about that?
Okay. Well, on the counseling, let me check with my wife first, and see if that's something she wants to do. Yeah, but I think about that.
All right. We'll take it and think about it, and if you decide you want to do that, just give a call back here to the office. We can set that up.
Okay.
All right. And what about a next step for you in terms of your marijuana use? What would you like to do about that?
Well, based on you and based on what I've been hearing, I guess I need to go ahead and try and cut back a little bit. Maybe I can just try going. I don't know. I ain't gonna make no promises. Maybe just say maybe three days a week rather than well, I can try to do that. Just cut back at the weekends or something.
Yeah.
And like that. Let me just sort of think through.
Well, Terry, I think that's a good plan. I'll write you a prescription. You can pick that up at the desk on the way out. Start taking your medication. If you and your wife decide you want to go forward with the counseling, just call back to the office here and we'll set that up.
Okay.
I will see you in 3 to 4 weeks. And I have a handout for you that I'd like to give you. It has a lot of medical facts about marijuana. We find a lot of people are not familiar with all of the different medical and mental health complications you can get from marijuana, but it's something that'll give you a little bit more information to think about.
Okay. All right. Well, I appreciate this, and I'll take a look at it.
Okay, very good. And I'll plan to see you back in 3 to 4 weeks.
All right. Thank you. Thank you, Doc.
Thank you, Terry.